Hello, my name is Laura Dawson. I'm the chair of the University of Toronto Department of Radiation Oncology, known locally as UT DRO. It is an honor to oversee scholarly activities, education, and wellness of our faculty and learners. The residency program is a priority for the department, and we are continuously aiming to elevate the quality of the program while improving the experience for our residents. Residents spend the majority of their clinical rotations in two of the most prestigious radiation oncology departments in the world, the Princess Margaret Cancer Centre and the Odette Cancer Centre in Toronto, with ability to interact with internationally renowned leaders and to participate in practice-changing research. Residents also have the opportunity to rotate through UT-DRO affiliate clinics outside of Toronto, including Southlake, Trillium, Barrie, and Lakeridge, for a more clinically focused experience and beautiful facilities with outstanding clinicians who are mostly UT-DRO alumni. Radiation oncology is a wonderful specialty, combining advanced technologies with human touch to deliver person-centered, cost-effective therapy to help cancer patients live longer with improved quality of life. This is such a rewarding specialty, and I hope that all residents will feel the joy that the UT-DRO faculty experience every day in the clinic and through multidisciplinary, sometimes practice-changing research. On a personal note, I am thankful to the UT-DRO residency program that set me up for success and left me with lifelong friends, including Dr. Sao, who's the UT-DRO Vice Chair of Education.
For the medical student or medical doctor exploring residency programs in terms of training in Canada, there are many benefits to training as a radiation oncology resident at the University of Toronto. Firstly, the size of the program and the accomplishments of the department are impressive. Secondly, Toronto is the most diverse city in Canada. For example, hundreds of languages are spoken in the Greater Toronto Area. Patients come from diverse backgrounds. These factors contribute to the benefit our residents have in terms of learning the full spectrum of radiation oncology patient care, from common oncology situations to more complex ones and to rare ones. Our residents are highly trained and they have the opportunity to take electives outside Toronto. Residents are also fully supported in their transition to the discipline as practicing radiation oncologists. Our residency program director, Dr. Andrea Baziak, is instrumental in this success.
The goal of our residency training program is to help the residents become well-rounded and competent specialists with skills in all of the CanMed's roles: medical expert, communicator, collaborator, etc. The first year of training is focused on foundations: medicine, acute cancer patient management for inpatients and urgent care, relevant surgical rotations, medical oncology, and palliative care. Years 2 and 3 are cancer site-specific rotations, allowing the opportunity to focus the learnings all on one type of cancer at a time through tutorials, clinics, planning, and tumor boards. By the 4th and 5th year, residents will get to choose their staff and cancer site they wish to enhance their skills in, eventually being able to independently run their own practice in anticipation for a successful transition into their career. Competency by Design has enabled more flexibility for each resident to tailor their residency experience to suit their interests and needs to best prepare them for a life as a radiation oncologist. In addition to clinical learnings, there are a lot of opportunities to pursue scholarly inquiry and get involved in different research projects that give our residents an enhanced appreciation of their own potential to contribute to advancing our profession and becoming future leaders in our field.
UT-DRO's residency program is centered at two dynamic high-energy cancer centers, the Princess Margaret Cancer Centre and the Sunnybrook Odette Cancer Centre. You'll complete your core disease site rotations at both centers with subspecialized rotations in pediatrics and sarcoma at the Princess Margaret. At both centers, you'll be exposed to state-of-the-art treatment techniques such as stereotactic ablative radiotherapy for spine and liver tumors, interstitial brachytherapy, as well as adaptive radiotherapy techniques. You'll also be exposed to cutting-edge technologies such as the MR-Linac, and you'll be working with some of the preeminent world experts in many of the disease sites at both centers. As well, another advantage of training at UT-DRO is exposure to numerous institutional and cooperative group trials, which will expose you to leading paradigms in treatment management, which can prepare you for the future.
Hi, I'm Jay Detsky, the Associate Program Director for the Residency Program and a staff radiation oncologist at the Odette Cancer Center at Sunnybrook. I'm also a graduate of the Toronto Residency Program myself, having finished my training in 2018. In Toronto, you will have access to all the newest, most advanced technology in the world of radiation oncology. At Sunnybrook, we make excellent use of our Gamma Knife machine to deliver the most precise, accurate, high-dose radiosurgical treatments for smaller brain metastases and some benign tumors like vestibular schwannomas. We are very active in using our MR-Linac machine, a new device that combines an MRI with a radiation delivery machine that allows for truly personalized radiation treatments, which we are leveraging to run trials for adaptive radiotherapy for brain, pancreatic, and head and neck cancers, among others.
One of the advantages to train at University of Toronto is our large brachytherapy program, with many hands-on opportunities for residents to learn LDR and HDR prostate brachytherapy, as well as all areas of gynecological brachytherapy. The U of T program is an international leader in interstitial brachytherapy for gynecological cancers. We have also introduced skin brachytherapy and treatment of hepatobiliary cancers into practice here at Sunnybrook. We are always looking for ways to improve our cancer outcomes through technology and innovation, and there are many opportunities for residents to become involved in your areas of interest.
The University of Toronto Residency Program is a collegial group of residents and staff with many different interests and areas of expertise. I was attracted to this residency program to learn from staff who are leading innovation in their fields, as well as for the large group of co-residents who are a great support for group learning, as well as leaning on for any questions you may have in clinic. There's so many activities to do in the city of Toronto, and we're always hanging out, whether it's going for food, different sporting games, or events in the city. Overall, I think the training program at the University of Toronto is extremely comprehensive, but also allows the flexibility to choose areas of clinical interest in the final years as we transition to practice, whether it be through electives or doing more blocks in disease sites that we may have more interest in. I believe that the University of Toronto is the best place for me to reach my full potential as a future radiation oncologist.
Here at UTDRO, we place a big emphasis on mentorship. We have a formalized mentorship program where the staff is paired with a first-year resident, and they help them navigate through the system, including many different vast resources, and help them succeed in their journey. During my time of my training, I have been paired with different formal staff and also have had developed different connections with informal mentors through the program, which have helped me achieve my goals in leadership, medical education, and research.
My name is Dr. Raman, and I'm a recent graduate from the University of Toronto Radiation Oncology Program and new staff at Princess Margaret Hospital. Training here has prepared me well for life as a staff radiation oncologist. I feel well educated, ready to manage patients independently, and comfortable with cutting-edge radiation treatments and techniques. The links I made with co-residents and staff at the University of Toronto have provided me an invaluable resource for staff practice. I feel fortunate to have trained here and look forward to meeting the future radiation oncologists who will also have this opportunity.
Now, let's ask the residents what their favorite thing about the Department of Radiation Oncology is.
I value how well the program incorporates resident feedback.
I like how supportive the program is of our research interests. I value the strong connections between staff and residents.
I love how my co-residents became my best friends.
I love how friendly and approachable everyone is.
I like how we get to work with cutting-edge technology.
I love working in downtown Toronto and being able to experience all the wonderful restaurants that the city has to offer.
I really enjoy working with all the tight-knit interdisciplinary teams and wonderful staff.